Am I audible, Dr. Balamurugan?
Yes, ma'am, you're audible, ma'am.
Okay. Before starting, let me take this opportunity to thank the authority of Ramaya Institute of Nursing Education and Research, and particularly Dr. Balamurugan and Mrs. Kusum for coordinating and giving me this opportunity to be with you all in this platform today's morning. Thank you. To say on role of nurse consultant, we all should admit that there is no as such specific role that is being identified or that is being outlined, that to say that these are the role of psychiatric nurse consultant. So what we are doing, as there is no specific job description, but we are in a time, or we are in a place of demand that we have to identify ourselves with different roles, different positions, with our advanced level of preparation in mental health nursing. So all of us, I feel all of us, we are in a process of establishing our role, identifying ourselves in the places of work to start something new, start something contribute towards the society to enhance the mental health of everyone. So we are in the process of identifying our role as a psychiatric nurse consultant, or maybe a clinical nurse specialist, or maybe a nurse practitioner in mental health nursing. So this presentation, or throughout this presentation, so what we'll be doing, we'll be trying to see how we are identifying our role as a role of nurse consultant. And also, I'd like to say before starting, the typical role, what we know, role of as a nurse consultant, as a leader, nurse consultant, as a mentor. I'm not going to focus directly on that because time constraint is there, time limit is there. So we'll be seeing how practically this role of nurse consultant can be implemented in different care settings. So I feel that that will help ourselves to look at our roles, look at our preparation, our mental health nursing academic preparation or clinical preparation, and identify our roles. So for this purpose, I have outlined my presentation in what I wanted to go with, a concept of psychiatric mental health nursing today. Today, how do we view this mental health nursing? Then what are the role prescribed? Already there are some role prescribed for psychiatric mental health nurses in world scenario, in Indian scenario. And also, I feel for me, it becomes very much important that I realize that, our roles are getting changed or getting more identified, the spatial role, that consultant practitioner or the clinical specialist role, through implementation of standard of practice in psychiatric nursing. So I'd like to take some time on focusing on that. Then what I wanted to discuss here is the challenges in implementing this kind of roles. What are the challenges? And last few slides I'll be doing on how we can mitigate these challenges, how we can incorporate these changes into our practice through our role. So with this, I think we'll be going through another 1 hour journey with this topic. To introduce what we do feel, the major issues and challenges in today's mental health nursing practice is to struggle for providing adequate care and services, incorporating newer developments in nursing. So all of us, we are in that stage. All of us, we are facing different issues and challenges because, many new changes that we'll be seeing and throughout the presentation, what are the newer development, how it has come, and what are the newer roles that is being coming into place, and how we are facing these issues and challenges. So I feel today's point of time for me, and for I feel the majority of the mental health nurses, this is the major issue. Changes in the field of mental health nursing is demanding updates in knowledge, skill, and awareness in understanding the complexities of treatment and evolving role of mental health nurses. And also, I'd like to focus that changes in healthcare delivery system have created many new opportunities for mental health nurses. Like, for example, independent practice, that independent implementation of nursing care with independent decision making, that is coming up as a newer opportunity or scope for mental health nurses. Mentorship, consultancy in mental health. So all these things are coming with the changes of healthcare delivery system that we are going to, I am not mentioning in the introduction slide, we are going to see what are the healthcare delivery system, how this has brought different roles changes in mental health nurses. Here I have just given you a definition, which already we have so many definitions on mental health nursing practice. But for today's discussion, the role of mental health nurse consultant, I feel this definition of mental health nursing is more appropriate, where it says mental health nursing practice refers rendering of professional services by adapting promotive, preventive, curative, rehabilitative measures either independently or as part of healthcare team by a registered nurse with adequate academic and clinical experiences. So these few highlighted words are important for today's discussion. That is academic and clinical expertise, which a nurse consultant, to perform a role of nurse consultant, one must acquire this expertise and strive to acquire this expertise. Then there is a role of healthcare team, because the consultant, when the consultation is required, where there is a teamwork, consultation will required in that time. So this is a multidisciplinary teamwork. So that is important, I feel, on today's topic. And independent decision making, because many times you have to design interventions, you have to take a decision, you have to take decision on designing and implementing the care, or the coordinating the care, or liaisoning. So there are lots of things where independent nursing decision making is required. So I feel that's why I felt that this is the most appropriate. It is, I'm just giving you the thoughts, I'm just whatever I am thinking, or I feel like I'm just putting it. Maybe we may have later on sometimes where you may also incorporate how we all can go about, because I feel all of us as a team, we should go about in establishing these new roles in mental health nursing. And also here we say that that in the definition of mental health nursing, I feel that nurse consultant role comes throughout the lifespan. You will be seeing a psychiatric mental health nurse consultant. You may see a geriatric mental health nurse consultant functioning as, you may not see those designations as such, but when you analyze their activity, you may find a different lifespan. Adolescent mental health nurse working with the adolescent, providing consultation services to the adolescent. So throughout the lifespan, it is being exist. So that I am focusing. And also, it's one more thing, it's important, it's a basic definition, the last point what we are putting, it's a purposeful use of self and use of scientific base as its science, theories as its science. So this is also important for a nurse consultant to perform the role of nurse consultant, because without this scientific base, without this evidence of practice, one cannot perform this role of consultant. So that's how I felt that these few things in existing mental health nursing definitions becomes more relevant in the role of consultant. Also, while we say about the role of nurse consultant, we do consider mental health nursing as to be holistic mental health nursing practice, which considers the need and strength of individual, families, as well as the community. Also, these roles comes into place because our mental health nursing practice is expanding with our advanced level of preparation. There are many new things are coming in, and there are many new demands in different settings are coming in. So with that, our rule of providing consultation, providing liaisons are coming in. So we say that mental health nursing practice is expanding, And we also admit that, mental health nursing is inclusive of evidence generated from research. So whatever a consultant now using or doing or implementing, mostly it is shown from the evidences of research that we are trying to implement in our real care setting. So with this introduction on the mental health, what is mental health nursing? Here I just give a concept on what is the concern of mental health aspect into this. So we know that concern on mental health aspect of nursing care was there for a long time, as we know, as we see the trends, as we see the history, but we know this practice is flushed by prominence of evidence-based practice, and also by introduction of different theories of nursing. As it has come, it has given us a new thought to think and utilize those theories in different practice settings, in different areas, in different mode, through various modalities of nursing care intervention. So we have to acknowledge the emergence of this kind of development in nursing, which has led us with the emphasis of mental health nursing more on importance, application, and scope of practice. So all these things, all this development has given us a platform to think now with different this kind of rule. What now, right now we are thinking, right now we are discussing because of all this development, all this, the changes that has been evolved in mental health nursing. Also, to bring about the changes in our role, it has been geared up through various the process of changes in mental health, like for example, changes in focus from exclusion to inclusion. I hope all of us, we are aware now about the Mental Health New Care Act, how it has made it inclusive. Earlier the concept was exclusion, custodial care. Now the concept of inclusion of community in care, inclusion of family in care. So I feel the role of a nurse consultant emerges here as a family nurse consultant, as a community mental health nurse expert or consultant, to include, to make it inclusive, the care system, the care delivery system. Or maybe there may be other changes, like in policy, like for example, National Mental Health Program or National Mental Health Policy, that has made some changes, that has made identified the nurses with a different position, with a different role, that definite role of a nurse in community or definite role of a nurse in different care settings. So with this, these new roles, like clinical specialist, consultant, advocacy, all kind of things are getting in. If you analyze, you will see, if you have to follow those policy, you have to change your role to different setting. Apart from basic care provider, you have to go beyond that to implement these kind of things in the community. Another important milestone for bringing the changes in nurses' role is the publication of standard of psychiatric mental health nursing practice. That I am taking some more time on that. That's why I'm not discussing here. In the next few slides, we'll be dealing with that. And also Mental Health Care Act. Mental Health Care Act 2017 has given us an opportunity to look at ourselves by including ourselves in the total care process as a team member in mental health care. Now you may see there are different designations are coming up after implementation of Mental Health Care Act. Like for example, last month we had advertised from state government where the advertisement to work in district mental health program, nurses to work in district mental health program was advertised as psychiatric nurse, which was earlier we have never seen a psychiatric nurse to be appointed in government setup. So now that has already been in place because psychiatric nurse are the team member in the Mental Health Care Act. So that position has been recognized and accepted in work setting too. So these are some things that has brought us into the place of which requires the discussion of topics like today. Also, while we are talking about the changes to bring these newer roles, one of the important development is telepsychiatric nursing services during pandemic. That has also created some role of nurse consultant. Also, evolving role of mental health nurses was there due because of this telepsychiatric nursing care processes that was initiated through different hospital in the country. National mental health policy already we have told. And also, to go on with the discussion on role of nurse consultant, we have to understand this paradigm shift of concept of mental health. Like, earlier the focus was only biomedical nursing, where the basic care was meant for the mentally ill person to give care, which has now been shifted to comprehensive paradigm. So to make it comprehensive, make it psychosocial, make it all the aspect of care, family, community, to include the role of nurse consultant definitely must be there. Then individualized nursing activities to teamwork, which is now in mental health. If you say mental health, we understand that this is mental health nursing is a teamwork. Always we understand in that way. So teamwork means there will be definitely a referring the nursing activities to a nurse, referring the psychologist activity to a psychologist, social work, that intervention that requires to a social work. So while doing so, you become a consultant because you are referred for the care that is being needed. You are consulted for the care to design that is being needed to treat an individual patient through multidisciplinary team approach, which is going on in many of the mental health institute right now in India. So what the focus we are making from the practical implementation point of view is the examples from Indian settings only. And also demands for expanding mental health nursing services, which is right now is coming as a, because of this national mental health policy or mental health care bill, whatever may be the reason. There are lots of demand to expand, expand your services to the community for geriatric group of people, expand your services, mental health nursing services to the adolescent, expand your mental health nursing services through the wellness centers that is being established all over the country. So with all kind of setups, all kind of delivery systems, demand is there more. Where demand is there, to meet the demand, somebody must definitely provide the service, provide the link between the service or go on with that. So that's how the role of consultant also arises. This all the previous slide, what we were saying, the healthcare delivery system or the mental health nursing concept, how it was changed and how it has brought the role of nurse consultant into place. Along with that, also we must agree that educational preparation in India also has expanded from basic to specialized nursing care. So as it has expanded from basic to specialized nursing care, we must become a special nurse too, because we were basic nurses, we were providing basic nursing care in the hospitals to mentally ill person. Now our educational preparation has made us some specialized mental health nurse. So specialized mental health nurse with their different level of advanced preparation in our curriculum system in India. So that has made us specialized. So now we become specialized too. We become bound to become specialized to provide different kind of service through by creating new roles like nurse consultant or clinical nurse specialist and things like so. As the so as already I have told, the second point, that mental health care procedures are specific. The specialized nurse prepared to carry out mental health advanced mental health care procedures. So specific role emerges, so that we are going on. The psychiatric nurse consultant, today's topic of interest, also is an outcome of all these evolutions, whatever we have seen. In India, we have seen this practice standard for psychiatric mental health nursing is in place since 2018. If you go to INC website, you will be seeing that practice standard for psychiatric mental health nursing and the role of nurse consultant emerging in the process of implementation and adherence of practice of standard of psychiatric nurse. I feel all of you, whoever in the clinical setting, whoever has the dual responsibility in implementing education into the care setting you all will be having the same feeling what I felt, because when we thought of implementing this standard of nursing care practice, we thought there must be some mentor, there must be some guide who will guide the nurses, the clinical nurses in implementing this care standards of psychiatric mental health nursing, so that mentor, that guide becomes the performer of role of nurse consultant. Even though I told in the beginning, the first before starting, again I am repeating, though in existing job designation, the concept is not seen to be exist. No, some places we do call that they're nurse consultant, nurse counselor, things like that. But officially, we do not have a designation of nurse consultant. But the functions, if you see, the functions that are being played by different level of psychiatric nurses are the function of, many times you see as a nurse consultant, functions of a nurse counselor, function of a nurse specialist, functions of a nurse consultant in child psychiatry, things like that. So, this, even though it is not exist, we are analyzing through our functions the role of psychiatric nurse consultant. Consultant, to say who are the consultant are the professional experts who provide expertise in understanding and intervene in the problem situations. Thus, a psychiatric nurse consultant may be seen in different work setup in mental health care practice settings. So there are different settings where there is a need of a clinical expert to provide their expertise to design the care needed for different group of population. That's how the role of nurse consultant or role of a psychiatric nurse consultant exists in different settings. So in a few settings that that I just put here, scope of practice for a nurse consultant is like, for example, OPD and indoor setting where she can perform her role as a nurse consultant mentor, mentoring the clinical care nurses or mentoring the training nurses in OPD indoor setting. There is a scope of nurse consultant. Working with families, when there is a work to do with families, a nurse consultant performs the role of nurse consultant for family nursing. Maybe a nurse consultant in school mental health nursing, that we'll be discussing how it comes. Many times when you work in particularly the persons who are engaged in the work of child adolescent psychiatry will be knowing how important to provide consultancy or making liaising with school mental health to make the care of child and adolescent as comprehensive care. So they are the role of nurse consultant in school mental health, community mental health services, that is ongoing on the vast scope that is being in practice all around, community mental health nursing services. Also, we do see the role of nurse consultant in geriatric mental health. Child already have mentioned, de-addiction nursing, as well as rehabilitation nursing. So there are many other areas also, now pandemic, disaster kind of things where there are roles of nurse consultants that exist. But these are some things that we are practicing right now. So I'm just mentioning few. You may go on aid the areas or the scope where a nurse consultant can function. Changes incorporated. In next few slides, we'll be seeing how changes incorporated and how nurse consultant becomes active. This mental health nurse consultant becomes active. A as I told, I was like, really I was feeling that, the standard of nursing, psychiatric nursing or mental health nursing practice has made us to think of these different kind of rules. So what is the standard of practice? Standard of practice represent these acceptable requirements for quality nursing care, and to deal with this to deal with different area care of focus, we are using this standard of practice. Like for example, focus on the standard of practice gives a focus on evidence-based care, meets the higher consumer expectation, also mitigates the challenges to meet quality care requirement. So to have this, we have a consultant to handle or to deal with these areas of implementing standard. To now, if we want to come to the practical issues of implementing standard of practice and how a nurse consultant's role exists, or how a nurse consultant functions in implementing this standard of practice. Like for example, I'm just giving you few standards here, and we are trying to analyze the challenges and the role of nurse consultant. Here, standard ones, it's all of, I'm not going to say details on the standard because it is all mental. I believe that in this platform, all the nurses who are there are aware of mental health and nursing care standard practice. So I'm just taking the point, and my focus will be on just to see the role of consultant in implementing this standard, how we are doing so. So first standard may be comprehensive assessment. So it requires some kind of expertise. Challenges maybe while implementing this, you will be seeing required knowledges, required a good observation skill, requires the ability to prioritize the issues. So what a nurse consultant do here, how she can come in, a trainee nurse or a basic care nurse who will be doing the comprehensive assessment to fulfill the standard of care practice, and the consultant will provide her expertise, provide guiding or mentoring with the observation skills, how to guide and how to look at the things while assessing, how to prioritize the issues. So these are the things a consultant helps, our consultant does in implementing this practice, standard issue. Maybe a second standard issue is the identifies realistic goal. So our demand is to implement, identify realistic goals. Now it requires make the goal holistic. As I told, now the care focus has been shifted from individualized care to holistic care. To make it holistic, inclusion of client, family, community, where a nurse consultant comes in to liaison with the client, with the family, with family, to find out the needs, to determine the goal of care, and make a liaising point with the basic nurses, or training nurses who will implement the care and who will definitely design the goals and set the goals. Here, what I'll do, later slides, I have also shown some of the examples of my practice settings where we do practice this kind of things. Only things, it is theoretical portion. I just would like to focus you first, so that we have a understanding to go on with the role of a consultant, how it emerges and how we practice here. Then planning. Here some challenges occurs. Challenges which requires the expertise of a nurse consultant to mitigate the challenges. Challenges like inclusion of possible alternatives, individualized care, inclusion of current evidence for care, collaboration of care. So these are the things it requires. These are the challenges it comes while implementing the standard of planning. So to implement the standard of planning, a consultant does this, help or mentor to make the care individualized, inclusion of current evidence, because her knowledge and expertise will guide the care implementer to include the current evidence of care. She is being a team worker. She will collaborate the care with different agencies which is required, like agencies may be a family, agencies may be a school, agencies like, maybe a care home, whatever may be, so that, that care plan, whatever the plan we are making, that becomes more quality planning with the adequate standard of care. Many times we do see some kind of challenges during implementing the care. Like, for example, sudden crisis occurs while you have a plan, good plan of care you have made, and while implementing the plan of care, there is sudden crisis occurs. So the role of nurse consultants gets in there. There is a requirement for a nurse consultant to handle this kind of crisis. Like, just the day before yesterday, something it has just strike to my mind. That's why I just would like to put an example here. Like, for example, one of the trainee nurses who were assigned to take care of a person who is on medication for last 25 years, suddenly he had a relapse. After 25 years, he had the relapse. So relapse due to medication non-compliance, but for so long he was compliant to medication. With this problem, the trainee was assigned to give a care implementation. So she has designed a medication adherence teaching plan for the client, or the medication intervention with family and the client. So what we were saying, that the question of sudden crisis, how it was coming, the person was well educated, he knew everything. For last 25 years he was on medication, so he was going on saying that I know everything, I know this, I know why to take medication, how to continue this medication, what is the importance of follow-up, but I don't know why this has happened. Where you try to understand me why I need to stop this particular medication suddenly. So, for a trainee nurse to understand that point becomes very difficult. What happened suddenly? Because, her implementation, her plan, what she was trying to implement got failed because she was not being able to continue with the plan because of the client's conversation. So she has seek the help of a nurse consultant, nurse faculty supervisor. We do call here as a nursing supervisor also, clinical nurse supervisor also, we do call them the consultant. So those consultants, he seek help. Where is the problem? What happened? So the consultant has come in, rightly detected the problem, because there was a new medication started which has created lots of difficulties in the person, which led him to medication non-adherence. So until and unless you identify that issue and handle that issue, you cannot implement whatever the plan that you are making for the patient. So this kind of sudden crisis occurs in real practice settings, where a nurse consultant has to come in and guide the person to carry on the care implementation in a proper direction. Also in implementation, inclusion of psychosocial interventions are coming in, which requires a nurse consultant to come in to implement different kind of psychosocial interventions that I'll be giving you the examples from practice settings in the later slide, because if I go on talking here, I don't think I'll be able to complete within my stipulated time. Here, the standard, quickly I'll go through standard practice like evaluation, academic excellence, where a nurse consultant's role is to monitor regularly. That's ongoing monitoring and evaluation, what a nurse consultant does while evaluating the care that has been implemented to the mentally ill client in different kind of settings. Then team building and upgradation on a regular basis is very much important for a nurse consultant, because it is not a job of single hand. The nurse consultant, what they are doing are the job that is being done with a team of experts. So her role is also to prepare those mental health nurses as expert, to make them expert in implementing the care. So team building, we feel is an important role of a nurse consultant. Here, in implementing the professional performance, a role of nurse consultant becomes a collaborator. As I told, how he or she collaborates with the care delivery, how nurse consultant act as a leader, and so on. So these are something related to standard. In quality practice, a consultant usually look at, these things are in place. Like, for example, utilizing nursing process in proper way, providing care in a responsible and accountable, also ethical manner. Because as we told, now we become independent in our care decision making. So that independency in nursing profession has also made the nurses accountable towards law, accountable towards
Arunjati ma'am. Ma'am, there is some, I think, network issue, ma'am. We are unable to see you.
Are you getting now?
With your video, we are unable to see you, ma'am. Yeah, now we are getting, yes. Yes, ma'am. Slideshow, ma'am, please.
Pardon?
Slideshow, ma'am. Your PPT.
Now, is it visible? So,
And just a second. Yeah, yes, done, ma'am. Please carry on, ma'am. Thank you.
okay. So what we were talking on, to make it sure that, that quality of practice is in place, that nurse consultants has a role to see that these things are happening, to coordination of care and advocacy. Advocacy, I feel very, very important in different settings. What we are seeing, to implement a newer nursing care or implement a research-based evidence, like, nowadays so many PhDs are there, so many different kind of nursing interventions are being proved effective, and we are trying to test in our care setting. But, for that, we need to have the advocacy, because, we need to say that, justify that, how it will help our patients. So kind of advocacy will do that. And definitely a nurse consultant has to take that role of advocacy and try to coordinate the care with different kind of interventions. So these few points, I just put it here to say that, how a nurse consultant makes sure that quality practice is in place. Also, already I have mentioned about the ethical performance and demand for changes. So these are some things that, confidentiality, maintaining regulatory parameters, keep on upgrading the nurses, keep on having a continuous upgradation on this kind of practice standard is also a nurse consultant does. And here, one more important thing that is coming up is, we are aware about the Indian Nursing Council Act, and the state says State Nursing Council Act. Also now in the process of that implementing that NNMC bill. So we will give us some different kind of scope of practice. NNMC bill, this 2020, if you see, it indicates the scopes like clinical nursing practice, nurse practitioner, and things like that. So implement this. I feel once it will be in place, I feel we'll have some further more scopes and thought to implement the role of mental health nursing care in different way. But there are some issues and challenges in this NNMC or maybe in our Indian Nursing Council Act that when putting, as even though it is not in place right now, but we should be prepared to think where what kind of things that can be done once it comes in place. Like for example, standards and scope of nursing practice, it will be regulated later as the standard and scope has been identified and it is being written that and then that commission has a power to identify these standards and scopes of nursing practice. So what we are thinking, why I'm putting it here, so there when we are thinking of implying the scope of nursing practice, we must definitely think of how we'll be looking this nurse consultant role or clinical nurse specialist role or different nurse practitioner courses that are already in place, how those nurse practitioners role can be implemented through this new bill or new commission. Then role and functions. As I already told, we don't have a specific role and functions for the advanced prepared or specialist nurse. We have the education level of preparation till PhD, but right now in hand we don't have as such definite roles and functions that has been identified or that has been prepared for psychiatric nurses. So maybe we can think of once this regulation comes to get in and put all kind of things, and also the legal liabilities. That is very, very important because in today's era, we have to be aware on that also. So along with role, functions, scopes, this legal liabilities and things like that may be included. These slides, I think already I have discussed. Like as nurses move towards more autonomous practice, professional responsibility is also increasing and nurses are becoming more accountable for their clinical decision making. And this is very much important to sustain our role, until and unless we become competent, we become aware, we can make ourselves fit to assume this role. We cannot assume and we can assume, but we cannot sustain this role. So for sustaining this kind of understandings are very much important. As I told, psychiatric nurse consultant also has some role to have a research nurse consultant. So how research nurse consultant can facilitate the research and in mental health nursing, maybe by promoting, maintaining, restoring physical mental health. This kind of research may be initiated, or this kind of research can be mentored, maximizing functionality, well-being concept and well-being and wellness concept is like, now it is more in forefront of the mental health nursing practice. So maybe this kind of things, and most importantly, developments of care guidelines, which we are missing in India. Like, always we feel that we need to have some kind of care protocols for different kind of advanced interventions, like psychosocial advanced interventions, whatever we are doing, family nursing intervention, or like, psychosocial nursing intervention, all kind of interventions we do have in place. But, we may think of, as a nurse consultant, we may take up the role of developing these care guidelines for implementing these different interventions. Also, a psychiatric nurse consultant can mentor in research by shift of focus to interventional research, which is very much in need. Then quantitative to qualitative and mixed research. Then ethical soundness in research, like, for example, clinical trial registry kind of things. Mentoring these kind of things will definitely enhance our standard, and definitely it will prove a consultant role in real sense. So here, I think I have 10 minutes more. So this 10 minutes, I'll just quickly try to take you how a psychiatric nurse consultant functions, with how we do visualize, like, service delivery in OPD setting. OPD settings, you may have different trainee nurses, you may have basic psychiatric care nurses, we call clinical nurses, with mental health nursing qualification. So what are the activities that you do? You may get referral, or you may have direct activity, like, direct taking activity, like, for example, screening, group psychoeducation, intervening with a family for mental health nursing care need. You may have some psychoeducation in group, family, or individual. You may have some kind of therapy, psychosocial therapies, mostly maybe relapse prevention therapies, or maybe you are engaged in admission and research counseling. The referral you might get, like a patient, suppose a psychiatrist has admitted a patient, which may be referred to you for admission counseling, or patient is getting research, which may be referred to mental health nurse as a for research counseling, or maybe for MET, motivation enhancement therapy, or maybe for social skill training, or maybe for intervention on home-based care, like, patient will be going home, so how a home-based care will be continued intervention on that. So these activities may be taken up by a trainee nurse or by a clinical nurse who is sitting in the OPD, where a nurse consultant will mentor the or facilitate the procedure of implementing, whether it is going in right track or not. So these things what we are doing every day in OPD. We do have in every psychiatry OPD, we do have a team of a psychiatrist, a mental health nurse, or a psychiatric social worker, clinical psychologist. So they do get referral according to the need of the patient, where the mental health nurse, they will act as a consultant to coordinate the care on different directions. These are some examples. There may be different care needs which may come in. Just I'm putting some examples and how the care process goes on. You need some facilities for interventions. To have a role, sitting a nurse consultant merely will not do until and unless you have facility to implement those role for interventions or providing care. Like, intervention room may be like, these you may see, these are the examples from here, just I'm putting. I believe in many of the places these are in place. Only thing how we do implement the question is that how do we coordinate the care and try to establish our role in this kind of settings. And also, I feel what we are doing, designing and implementing mental health nursing interventions through various research. So, like, for example, all the hospitals, Dr. Balamurugan has in the while introducing, he told there are many PhD nurses attending this meeting or attending this lecture. So, all of you are doing some kind of research to improve the quality of care in a mentally ill person. So why not we implement those cares in real practice settings, not only the research, apart from research, then bring into the practice. Like, for example, we are having right now the ongoing examples from a PhD research project, what is being implemented in the care settings. I'm just putting some example. Psychosocial interventions for family of schizophrenia patients, this is going on. Interventions towards enhanced well-being and treatment adherence, that is going on. Community-based intervention to enhance well-being of antenatal mother on regular basis, it is being going on. Interventions for person having substance use disorder is going on. In CAP, child adolescent psychiatric unit, the parental management training programs are going on regular basis as a implementation of standard psychiatric nursing care, and these are result of some PhD research project which were carried out by PhD research scholar of the Department of Nursing under the institute. So this way we can establish the role of nurse consultant in different dimensions. So these are some interventions and example. As I told, indoor nursing care, it may be you may choose a case and take independently decision to provide some care needs if you are identifying, or as a multidisciplinary team, you will the mental health nurse who are attending that multidisciplinary team of that particular indoor might get referral to give this kind of or design this kind of interventions. So where she act as a nurse consultant, because she will be consulted for the needed nursing care for that particular patient in the area of nursing. So these are some kind of examples that a nurse consultant takes while implementing nursing care. Then also in community, a nurse consultant has lots of role, like, some examples that what we are doing from here, I'm just putting here, we are making some home visit for case identification, referral, then teaching for home-based management. So this needs definitely some consultative services from the nurses to make the community, to provide equitable access and make mental health in real sense for all. So a nurse consultant does all kind of things, the awareness activities, different kind of awareness activity, then extension service as a part of it. Extension clinic member, group and individual who is are being carried out by mental health nurses from this institute. So these kind of activities that we are doing right now. I'm a little bit fast because I thought I should finish within time. Then creating awareness among public, that is one of the major role I feel that is a nurse consultant then can take up on regular basis. So it may be carried out. Then community sensitization and awareness, these you are seeing different kind of settings, maybe somewhere in JNM school, somewhere in other regular school, in community, in antenatal clinic, in there are different settings where there is definite role of a mental health nurse. There are definite things to do by a mental health nurse for promotion of mental health and prevention of occurring of mental illnesses or the psychological distress. So a nurse consultant can get in, and only thing one has to think, identify and implement, approach the authority, take permission, go there, implement the knowledge, clinical expertise that as a mental health nurse you have for betterment of the community. So these are some examples that we are just putting here. Then capacity building, as we know, you will be seeing that as in standards also, as a requirement of the standard, it is capacity building is there. So different capacity building program, it may be for mental health nurses, it may be for general nurses, as now the focus is on integrating mental health care into general health care. So capacity building becomes more important right now in the present stage of doing functioning of nurse consultant. So this capacity building program, some sorts from different capacity building programs being organized. Then a helpline service, as I already been mentioned, how the nurse consultant role emerged here during this pandemic. So like, for example, in many institutes we have started where there are two levels of functioning. The tier 1, which we call by the basic nurses or by the trainee nurses. Trainee nurses, not only the nurses, it is a multidisciplinary thing. All the disciplines are there, psychiatry, social work, psychology, along with mental health nurses. So consultant remains here in tier 2. If the problems, it cannot be solved by a trainee nurse, mental health nurse, or the basic care mental health nurse, that will be further referred to tier 2, where the role of nurse consultant comes in. The nurse consultant helps to solve the problem, thereby the learning also takes place, and it facilitates the learning to the new learner too. So the prominent role of nurse consultant has been immersed in this pandemic through these telehelpline services. Then contribution in mental health service development, activities through state mental health authority. Already I have mentioned that our mental health care act has included psychiatric nurse as a team member. So now we have an opportunity to get in, for example, we are the member, I'm the member for state mental health authority for making guidelines and things like that. So where we can give our views in implementing this kind of services. So this way we can nurse consultant can act as a facilitator. Then there are some many times they act as an advisory board member, like for example, in our institute with wellness hub or hospital committee. So if you have the opportunity to get into this kind of committees, I feel that being a consultant, you take an active role of nurse consultant to implement different kind of policies that is in the betterment or that is in the line of mental health nursing practice with standard of nursing care practice. So these are some examples that just I put how a nurse consultant can contribute in mental health nursing service development. Now, though I have told you this, so many things are in place, but many places there are still some challenges to implement things. So how we can overcome this to establish our role as a consultant, as a clinical nurse specialist, or utilize our advanced practice knowledge into real care practice. Already that Mental Health Care Act 2017 has taken some initiative to provide a position. So that is being that we can utilize that opportunity. Also, I feel various association like for example, Indian Society of Psychiatric Nurses, Trained Nurses Association of India, kind of things can be influential in establishing this role, particularly when this NNMC will come up while making the regulation for scopes and practice by the nurses, identifying the scopes and practice by the nurses. It can be very much influential to identify specific roles or specific jobs or specific area of work by mental health nurses. I think that will lift us up with our opportunity to practice the knowledge, whatever we have learned through our educational preparations. Then another important thing, even though we scream, even though we say that we want this role, we want that role, we want this opportunity, until and unless we have the competency and proficiency, it is not at all possible to sustain this role. So we must being faculty, because I believe many of the faculties, the teachers are also attending this, we must give a deep thought to ensure competency during learning. Maybe I was thinking why don't we make some practice session under supervision? Anyway, training nurses are doing some therapies, some psychosocial intervention and things like that. Why don't you make competent by giving enough supervision, giving enough mentorship, by giving enough guidance while learning itself? So these kind of some steps, these are some small steps. If each one of us, we can think, being a nurse consultant, we can really give many nurse consultant in mental health nursing in real sense. Continuous hand-on skills, that is important, and theory learning in clinical practice. Now the some thoughts are floating, residency nursing, residency mental health nursing. So these kind of things, I think residency mental health nursing means you will be doing and you will be learning, you will be completing, you will be acquiring your degree in clinical setting itself. So there will be no separate theory learning and only going for the practicals. No, nothing like that. If this kind of situation comes in our learning practice, we may definitely make all the nurses, mental health nurses, competent and proficient in mental health nursing. I think I exceeded a little bit of time. Sorry for that. I just would like to conclude here. To conclude, I'd like to say leadership and initiative in all professional practice settings request to incorporate the changes. All of us, we must give a deep thought in how to incorporate these changes in our practice settings. So thereby the leadership role of nurse consultant will facilitate these mental health nurses to implement this care. Resourcefulness and flexibility to deal difficult situation, and also one more important thing, that motivate mental health nurses at all level. So to say here, when Dr. Balamurugan said me that you have to speak something on role of psychiatric nurse consultant, even though I know I am not a real nurse consultant, or we do not have as such ideal nurse consultant practice settings. No, but still I took up the challenge immediately, thinking that if all of us started deliver, or all of us share what we are doing, or how we are trying to establish our roles in different settings, might one day bring the change. So with that only, I just said, yes, okay, Balamurugan, I'll say what we are doing here and how we are trying to implement this kind of role of nurse consultant in practice setting, so that this was the only purpose for me, so that we can come together and we can bring the changes in our mental health care setting. Then advocacy for changes, request for high quality care, that I would like to say in conclusion, all of us, we must advocate for changes that request for high quality care. Then also in every state, mental health nurse must constructively utilize the position that has been given through Mental Health Care Act 2017 by developing various mental health services. So this will definitely help us. And the thoughtful implementation of changes in mental health nursing will mitigate the challenges in providing quality care, and will create a new dimension of mental health nursing by creating roles like the role of psychiatric nurse consultant. With this, I'd like to conclude. Thank you, everyone. Thank you, Dr. Balamurugan. I just completed. Just muted.
So much, ma'am. Your inputs were very much valuable to us and our students as well. So I hope all of you had a great time listening to ma'am with such a vast experience in our nursing field. Ma'am, I think there are a few questions in chat box that maybe you can answer.
Just one question is, one person asked, will you please highlight the reason regarding shortage and uneven distribution of mental health nurse? From the
Can you repeat the question?
yes, ma'am. It is in the question answer.
Shortage and uneven distribution of mental health nurses. Yes. Yeah, it may be what I feel. Definitely shortage is there, because we are seeing the mental health nurses only in the hospitals. Even though we have identified so many practice area, we don't have a nurse to post therein. So there may be a training gap. There may be the mental health, to prepare the mental health nurse specialist, the advanced level of preparation, the course is needed. Definitely, the institute has to run the courses. There may be gap in that, or there may be absorption. There may be problems in the absorbing, positions. To have the mental health nurses in place, government must have some positions in those places, so that they may get absorbed. So there are lots many reasons are there. So that's what I'm praying. We must advocate for that, as we have now opportunity in Mental Health Care Act to sit in the policy level decision making. At central also nurses are there. At state also nurses are there. There are mental health cell. So we have to advocate for all these kind of things and make the changes, so that we have enough nurses. Number one. Number two, we cannot just sit there, as we don't have mental health nurses, so we'll not render the services of mental health nursing. No, we cannot do so. So what we are doing, we are taking some measures, temporary measures, to bridge the gap. Like, for example, training up of general nurses who are working in periphery with mental health knowledge, so that basic care can be rendered. Like you may see that there are different digital programs are there through different institutes like NIMHANS, like we do have one digital academy program for nurses. So where we are trying to train the community health officers or the general nurses who are in periphery with basic mental health care knowledges, so that they can function at least basic. They can at least identify and refer the cases, or they can do the follow-up in the community itself. So these are some measures also being taken to stopgap arrangement. You can say this is a stopgap arrangement. I don't say these are the permanent measures. This will replace a mental health nurse. No, definitely we need mental health nurses in the place. So for that, it might take some time, but don't sit just like that. Do something, at least for the time being, so that that's what's going on. I think I answered what was your query. Any more questions?
Yes, ma'am, the answer was appropriate. Now, I think we don't have many questions in the chat, ma'am. We request our audience, if anybody has questions, kindly leave your question answer in the chat box. Question in the chat box. If there are no more questions, then we can move ahead with vote of thanks, I guess.
I feel there should have been some more questions, because all of us, like we are in the trialing sessions now. We can say that we are in trial in establishing this rule. So many questions, many things will come up. While you are implementing a new trial in an institute, new role of a mental health nurse in an institute or in a hospital or in a community, many difficulties comes. So if anything kinds of that, if I can answer, or I may get a opportunity to even learn from your difficulties, which you may face, we may not face here, or like, it may be something different. So like this, with the exchange of your ideas, we may have an opportunity to learn from each other.
Unfortunately, we do not have many questions, ma'am. I guess that was the only question put in the question and answer box. But I'd like to just say a few words that I had experienced, ma'am, during my master's. Actually, I had taken staff nurses working in mental health setup as my samples, and I faced a lot of difficulty finding samples for myself, because there was very few hospitals which had nurses working in psychiatric setups, and they did not have a psychiatric ward as well. Most of the hospitals had only OPDs for the psychiatric setup. And then while collecting the samples, I found it very difficult to find the samples from mental health setup. And if they had psychiatric ward, they only had only few staffs. It's not like how in general medical surgical setup they put number of staffs to look after patient. However, coming to psychiatric field, I could find only few staffs who were in rotational basis managing psychiatric patient. So I think there is again the same question which is related to my doubt is shortage of staffs in mental health field, especially the nurses, because patient cares are also compromised, as well as the nurses are also not been given a proper opportunity to work in mental health setup. So that is actually a present current scenario that we can face, at least in our Indian setup.
Yes, you are right.
Ma'am, now I think no more questions are there. So we will move ahead with the vote of thanks, ma'am. Yes, so good afternoon to all. On behalf of Ramaya Institute of Nursing Education and Research, I extend a hearty vote of thanks to our guest speaker, Dr. Arun Jyoti Barua from LGBRMIH, who spared time from her busy schedule to be our guest speaker for today's guest lecture titled Role of Psychiatric Nurse Consultant. Today we had an opportunity to hear from you, ma'am, your thoughts and your vast experience that you have shared. And this has surely imparted a very important knowledge and motivated all of us in knowing the details about psychiatric nurse. And to conclude the few points you have very well discussed about the present scenario of how the mental health nurses are utilized, and then the challenges that is faced by the nurses, and how to overcome the shortage of mental health nurses, and the scopes that are available for nurses in various mental health areas. Along with that, the role of psychiatric or mental health nurse in telehealth field. So all these points for sure, I think our audience and our delegates have taken it, uh, and they have got very detailed knowledge about it. And you have also shared your live examples of how you are practicing and implementing all these in LGBRIMH Assam, ma'am. So thank you so much for sharing your experience and your thoughts, ma'am. I would also like to extend our warm, hearty thanks to the management of Ramaya Group of Institute, and also thank you to Dr. Sonali Jadhav Tarachand, our principal, Ramaya Institute of Nursing Education and Research, and great thanks to Dr. G. Balmurugan, Registrar Administration, HOD, Department of Mental Health Nursing, Ramaya Institute of Nursing Education and Research, without whom this event would have been almost impossible. And finally, thanks to our special guest, Dr. Arunjyoti Barua, ma'am. Thank you for sparing your time and imparting our knowledge to our students. And last but not the least, the thanks goes to our participants who have also taken a time out to listen to our guest speakers for today. So thank you, everyone.
Thank you. Thank you, everyone. Thank you for this opportunity. Thank you, Dr. Balamurugan and Ms. Kusum. Thank you.
Thank you, ma'am.
Thank you
So
very
we
much,
would
ma'am.
love to hear you in the future
It was
as well.
it was very lively, and I'm recalling my visit to LGB actually. So it went on very nicely. So the whole aim, I think we satisfied our objective. We want the young people to be enlightened. There is something called a psychiatric nurse consultant is happening in the National Institute of Importance. So with this,
Yes.
once again, I personally thank you, ma'am, for your valuable time and your words of wisdom. Thank you, ma'am. Thank you.
Thank you. Thank you, everyone.
Sir, I'll log out from the event now.
Yes, yes.
Thank you, sir.